This is Jam Nation.
With Jonesy and Amanda.
Can you believe this? This time last year we were coming out of lockdown here in Sydney. Now, Australia-wide, all COVID isolation rules end today. If you have COVID and you have symptoms, stay home. If you're sick, stay home. If you want to go to work and you feel okay, you can. Yeah. The COVID payment, the pandemic payment's been scrapped unless you're a casual worker in aged care, disability care, Aboriginal health and hospital care. So basically, we are being told it's business as usual. The AMA, the Australian Medical Association, has slammed this decision. They said we're still looking at signs that there is another wave of COVID. We're coming out of one of the biggest waves of COVID yet. It's crushed the hospital workforce. We've got a massive logjam and backlog in hospitals. This is not the time for us to be doing this. I saw one of the newspapers, it might have been Daily Mail or something. They had a picture of Terry Irwin at the shops wearing a mask outside at the shops. And this is the headline: COVID's over, Terry. Right. Irwin matriarch still wears a mask outdoors like it's 2020. Let's not go down the American route where we vilify people for their personal choices, their health choices.
Yeah, that's your own choice.
I had COVID about a month ago. If I hadn't had COVID, I would be wearing a mask every time I went to the shops, every time I went to the movies. I wanted to protect myself.
But also, if you indeed do have COVID, you're not going to spread it to everyone else. Wearing a mask isn't a bad thing.
That's right, absolutely.
It's a free country. You can wear whatever you want.
But how do you feel that now pretty much the rules have been scrapped? Officially, we're pretending, despite 36,000 new cases across Australia in the week to October 7.
The overreaching thing is in intensive care and, more importantly, who's on ventilators. So in intensive care, as I understand it, there's 46 people in intensive care, but next to that, actually being assisted by ventilators, you'd find the number would be a lot less. So the government, when we went into this, the biggest concern was
we overflow
that we have
hospitals.
In New South Wales, we have 1,700 spaces for people to be ventilated. Their biggest concern was that would be overwhelmed. So right now, that's why the government is saying, right, it's time to
treat it like the flu. Hospital workers may say that's not the end of it.
Of course.
So what do we think? How are you feeling? All COVID isolation rules end today.